Approaching 5 to 7. It is the Wake Up Call on BBC Radio Kent. And of course, as well as nurses, doctors are on the front line treating patients with COVID-19, particularly doctors working in emergency medicine. We've all heard about the problems with the lack of specialist protective equipment for NHS staff. That's been a theme, hasn't it, for the last few weeks? But we wanted to know how bad it is. Well, let's talk now to Dr. Katherine Henderson, President of the Royal College of Emergency Medicine. I'm really keen to know what it's like on the ground, Dr. Katherine. We're offered all sorts of promises, aren't we, from the government? And all the time I'm hearing these briefings and they're telling me, yes, we've delivered all, astronomical sums of equipment, but is it getting through to the people that need it?
So good morning, Anna.
Morning.
Yes, it is. It is now getting through. We've got guidance published yesterday, which listened to, I think, a lot of healthcare workers' concerns, and that will be very reassuring. We're getting kit out there. It's become a big story, but I think we're going to be able to move on from that story with a bit of luck.
Oh.
We needed to get the kit to doctors and nurses in hospitals. We also need to get kit to GP surgeries, and also out into social care. Now, delivering it is a massive logistic issue. And hopefully that is now in place, and we'll be getting the equipment that everybody needs out there to protect both staff and to protect patients.
So you're getting equipment, and is the equipment adequate? I'm only asking because we spoke to a paramedic a little while ago who said they were given equipment which was good, but it was actually out of date. So can I just check that you're getting not just the equipment, but the equipment that is valid and it's going to protect you?
The guidance that was produced yesterday gives you tells you the evidence base for the level of protection that we're getting. Now, as long as everybody is getting that kit, that will work. So if people are not getting the kit that they need, they need to get in touch with their central services. But we have to wear the kit right. We have to make sure that we're using it correctly. And we need to make sure that people feel confident that they can get it when they need it. So it's going to be, this is a massive logistic exercise to get this stuff out there, but we seem to be getting there.
That's really, really good news. And you mentioned the new guidance that came out yesterday, Katherine. So what else did that tell you?
The big issue that it covers is the fact that it can be difficult to tell which patients have actually got the virus and who haven't. And before we were just going for patients who had obvious respiratory symptoms. Now we're protecting both ourselves and the patients. In case somebody's got a slightly unusual presentation, we're now wearing masks in what we were calling our sort of cold areas, our non-respiratory areas, just so that we can try and break that chain of transmission, because that's what's incredibly important. And where the public come in, obviously, with the stay home message, trying to break the chain of transmission so that we don't get services overwhelmed because we get a ramp up in the number of people getting the infection.
And it's interesting because the BMA have warned, haven't they, about a tsunami of COVID cases heading for London and the rest of the UK. We know London's a little bit ahead in terms of cases at the moment. Can that be prevented? I mean, is it important to reiterate to us, the public, that if we stay inside, then we can, level that tsunami, if you like?
This is the single most important thing. We need people to follow that guidance. We've got to stop transmission, because if we don't, and if our most vulnerable patients get coronavirus, they will need the services of the NHS, and we've got to try and make sure that we don't overwhelm the service. London is very busy. There's no question that London is very busy, but there's still capacity in the system, but we need to keep it that way. So we do need we need the public to stay at home. But we've also got another message, which is we do also need people who have got serious health problems not to ignore them. There is a bit of a concern that people who've actually got something quite serious wrong with them are feeling that they shouldn't bother the NHS, and they're having a heart attack or they're having a stroke and they're not getting in touch with the health service. Please don't do that. If there is something seriously wrong, or your child has got a really bad fever and you're really worried, please don't ignore it. Don't just stay at home. Get in touch with the health service, and don't come to harm from something that isn't to do with coronavirus because of worries about coronavirus.
Yeah, that's actually really interesting. And what's morale like?
I think people are nervous. They're worried that this is something that could become an enormous problem, and are very concerned that we all do the right thing. at the same time, there is the usual NHS pool together, and just listening to your stories, there is this community pool together
Yes.
that is an amazing. You hear the clap last night. These things are phenomenal. It's lovely to hear, and it's incredibly heartwarming. And we can get through this if we all do the things that we're supposed to do.
Indeed. Katherine, on that note, thank you. Great to talk to you this morning. Dr. Katherine Henderson, President of the Royal College of Emergency Medicine.